Walking is the best exercise that we know. Walking helps us to maintain health. It helps as a preventative for certain illnesses and diseases.
When I have acquaintances that ask me, what do? I'm pre-diabetic. My blood sugars are high. I've noticed my cholesterol to be high. My first recommendation to them is go out for a walk every day.
We didn't evolve to sit around on chairs all day and watch TV or sit around and talk with one another.
Walking benefits the cardiovascular system for one. It helps keep your heart strong, helps keep your rhythm of the heart strong.
Certainly it's going to help you with muscle tone, it's going to help you with maintaining an appropriate weight.
Patients who may be prone to developing dementia do better in terms of their memory the more physically fit they stay. So getting involved in a walking group tends to help diminish those effects.
Walking makes us engage in moving the lungs in and out, so we keep our respiratory capacity. People who have respiratory illnesses, for example, walking is perfect. Walking allows them the exercise to get their heart rate stimulated, get blood flow increased to the legs, to the arms, to the brain, and maintains their respiratory status so they don't have to be on oxygen.
Most antidepressants take roughly about 4 weeks to work. A better quick fix is walking briskly. Walking vigorously is an immediate antidepressant. Everybody that I see that are either depressed or anxious, I get them walking.
It's a well-known fact that weight-bearing and walking helps women maintain calcium in their bones and maintains the strength of the bones.
Many of my patients are coming to me looking for hormonal therapy or pharmacological treatments for osteoporosis, and although pharmacology has a key component, the even more important component is walking, and especially load-bearing exercises. What I emphasize to them more than anything else, if you're going to do anything, at least walk down a flight of stairs as much as you can.
That especially is important in older people where you can have easy fractures from a fall. A simple walking pattern can prevent that by almost 35 to 40%. Walking in general is also a way to interact with each other. I mean, I see a lot of walking groups. I see walking groups at lunchtime. I see walking groups in the mall. So it's not just a way of physical maintenance of good health. It's also a way of interacting with other people. It's a way of community.
It becomes part of your life, and you splice it in wherever you can, like parking your car way out at the end of the parking lot. Why park right next to the building?
No, I never run and do a task. I don't swim to go pick something up, but I always walk across the street to get something or walk half a mile to get a task done. And I think that's the important thing about walking, is that it could be exercise and it can be functional as well.
Every little bit of exercise can be a cumulative kind of effect.
Time is important. 20 to 30 minutes a day of walking is good, and it doesn't have to be strenuous walking. So there's a lot of good benefits from walking that can be social, it can be physical, and it can help lead to a better lifestyle and less need for medical interventions.
With all the benefits it has, take advantage of that. It's one of the easiest things that you can do to have the multitude of benefits on your health.
It shouldn't be based on convenience. It should be considered a staple part of your life.
It continues to be the best medicine we have. There's no pill that can give you what walking can give you.